Hello, everyone. Very good morning to all of you. I would firstly like to thank the organizers, Dr. Bhatia, and everyone in the team for giving me this opportunity to be like the session chairman today. Firstly, I would like to introduce myself. I am Saurabh Agarwal. I am the founder and managing director of Hemcan Solutions, and we manufacture different Ayurvedic medicines, supplements, skincare products in Orissa under the brand name Vedi Herbals. And with us today in this panel are Ms. Ranjita, who is the director of Sarthi Healthcare, and Dr. Milind, who is in the Swastik Wellness, the wellness director of this organization. So let me ask you for giving us an introduction about yourself and what do you think about the integrative healthcare? Thank you.
Want me to go? Hello. Oh, everybody at the back bench, can you all come front? Come. Everybody come front and just occupy these seats before my introduction. Yeah, now it looks nice. At least we can see you. So, my name is Ranjita Vinel and not Dr. Ranjita, so first correction. I have been a healthcare veteran past 27 years across different healthcare system in India, Middle East and Asia. I think we've had the opportunity to work on this subject from 2009 when people said, what is the business that you are doing, and it seemed like a story. So I run few companies, and one of our flagship companies called Sarthi Healthcare Private Limited. So we led this company, and we had the opportunity of sometimes working with even 1.2 million patients in a year. We worked with more than 25 therapy areas, and I'm not talking about just the chronic diseases that we hear like diabetes, lipidemia, dyslipidemia, or cardiovascular diseases. I'm talking also about diseases like, Pompe, Gaucher, where you may just find 200, 250 patients across India. So it's that small. So I think I only can think, and I always told the people in the organization that very few people are fortunate to have a work which is like social work. You don't have to do a social work to be in social work, because we are a commercial organization. And to achieve all this, we have collaborated in these years, 16, 17 years, with pharmaceutical industry, med device companies, consumer health companies, wellness companies, health, digital tech. So all of this was not achieved only by Sarthi. It was also made possible because of the association with all of these companies. Thank you. You have the mic.
Yeah. I'm Dr. Milind. I am a Ayurveda consultant and been into the well-being space last 17 years plus. Started as Ayurveda doctor long back, and the inquisitiveness into the science developed while studying it. When I see the roots of the philosophy and the roots the science has given out, it's outstanding. It treats the root of any ailment which is popping up. So actually, if I need to define Ayurveda, it is Ayusha Veda Ayurveda, which means it's a science of life. So a science which teaches you how to live is what Ayurveda is, and that interested me more into this science, and have developed a lot of protocols in terms of lifestyle issues. And I mainly practice fertility with Ayurveda. So I've seen amazing results in fertility, where people had lost hope in conceiving, in having multiple IVF cycle failures, bilateral tubal blocks, semen issues, and all this is coming all because of the thanks to the modern world to give this stress and the kind of lifestyles and the kind of food which we all are having these days is, inducing these issues. So basically, when we work with this science, it has helped to, achieve multifold results by improving on the different aspects of diet and lifestyle. And at Swastik Wellbeing Sanctuary, we work on similar principles, which is rooted, 5,000 years old into the science of Ayurveda. And it has worked wonders. We have seen a lot of reversals happening with this science. So that's a brief introduction of me. Thank you.
Great. Thank you for your introduction, and I'm happy to know that you're working with Ayurveda and diet, and we have like the whole spectrum of the different modalities, I think, on the panel today, from like pharmaceuticals and Ayurveda, wellness, and also I am representing the cannabis medicines, which is also something new. And so we also have seen good outcome using the integrative approach, where people who have already been using allopathy drugs and different Ayurvedic medicines for their treatment, and many of them have failed because of different diseases and issues, and when they use the cannabis medicines, we have seen that they are being able to recover from their pain and different kind of ailments that nowadays we are suffering from. Like you rightly said about the loss of the nutritional profile, the stress level is rising, there's so much of pollution. So I think we have to use the integrative approach, like in this tagline, with innovative approach, and to create the impact, positive impact in the everyone's life. So can you also tell us what do you mean by integrative healthcare, and what kind of outcomes have you seen with the use of integrative healthcare? Thank you. You can go first.
So for me, it's quite simple. I think integrative healthcare is important and it's must. And for me, it's just the combination of modern medicines, which is evidence-based, and combination with traditional-based practices. And I think when they are really integrated well, the patient who is the center of all of this that we're talking about is the beneficiary. And the best therapeutic outcomes cannot be driven only by drugs today, and we all understand this. So I think, I don't know, this is just to quote, it's an old study by Integrative Harris. It was done in North America and Europe amongst 10,000 patients. It's a huge study, okay? And patients with multiple disease areas. And imagine we are talking about a study which is done internationally. So we all know the insurance covers most of these patients. India, it's not common, but internationally, insurance company supports all the patients. Even when they were getting paid, the study said that 50 to 60% of the patients were not complying with the therapy. Whether it was simple therapy, oral drug, to complicated. Nobody was complying, 50 to 60%. Where probably they are more educated than us. Insurance were covering, that means they did not pay out of their pockets like India, and still they saw the benefit. So imagine what must be happening in India. And Sarthi's data over these 15 years, we work more than 60, 65 cities in India, and so we have different culture, family kind of situation, different language patients, we stratify patients, we'll talk about it, but in our groups, I think if we do not have a study, or let's not put it study, even if it's a program which is monitored, you never know what is the compliance. Probably we don't have even 30 to 40% patients complying to the therapy after going to the doctor. But when we actually worked with these patient groups in different studies and in different therapy area, we found the compliance to be 70 to 80%. And what is the meaning of compliance? Compliance doesn't mean patient लेता है कि नहीं लेता है. Compliance means if the patient is taking exactly as prescribed. That's what compliance means. Frequency, dosage. And I think हम सब ने घर में देखा होगा ना, we drop, ठीक होने लग गए. Antibiotic में 5 days we don't want to comply. 3rd day, 4th day we feel and we leave it. Imagine what must be happening in a chronic disease area, जो साल भर लेना है. And the study also said, okay, the study also said 30 to 40% of the patients drop out in the first year. So there is a huge challenge, and there is no other way than going beyond prescription and focusing on total care, which is what integrative method is. So I think if we have, I don't think it was not available before, but today's time, it is not just the present, it's also the future. So that's only way we all can reduce the disease burden, hospitalization, etc.
Rightly said, the dropouts of 30-40% where it's a long-term ailment, unless or until it's a necessity to live your life with utmost fulfillment. I think that is where people take it very seriously when it comes to the the long-term treatment process. For us, the integrative approach is a person as a whole, preventive aspect, and responsibility of an individual to follow the lifestyle and dietary regimens. Unless until we don't involve all of them, it becomes really difficult to actually be in the stream of well-being, your well-being state, I would say. For example, I would say today, if we see whatever ailments are coming through, emotional health, stress, the dietary patterns, lifestyle, all contribute to it. So integration of resolving all of them and going to the root cause of it will help us to get better results as well. So for example, in today's day, cortisol levels are pretty high in all of us. The kind of stresses we are going through, this high cortisol levels is impacting our metabolism, knowingly, unknowingly, and causing a lot of inflammation into the system. Nobody wants to get into the root cause of where is it all coming from. So once we analyze these patterns of the cortisol levels, the impact on metabolism, what it is creating, once the metabolism is affected, the kind of, the nutritional impact it is creating into the body, the accumulation of toxins which is happening is creating a complex ruckus into the system, blocking all the micromolecular channels which are responsible and disturbing the gut-brain axis. If you see, if a day you are stressed too much into worries and all, see how your gut responds to it. You don't feel hungry, you are lost in your own world with that stress. And see once the day your gut is unhappy, see how your mind is irritated. You are having acid reflux heavy, see how your mind is also irritated. So the gut is called as the second brain, right? So the integrated approach, when we work about on these basics which are related to identifying the key cause of any issue into the system and then working about it. That is what is integrative approach.
Great, thank you so much, and it's good to know about your perspectives and like complying with the treatment protocols, and also about the gut and brain axis. So the gut health and your emotional, mental health is equally important, and integrative health would be something like bringing the best of all the different modalities and dimensions, and helping treat the patient for a disease-free life. So can you also tell us about the personalization aspect in terms of how important do you think is personalization in terms of giving the treatment or planning the protocol for the patients on an individual basis? Is that important? Thank you.
In my opinion, I think it's the backbone. One size does not fit all. We know it's just not about shoes, right? It's all about everything else in life too. For us, when we worked on different disease areas, it was just not about a diabetic will be treated the same way across. So we actually did stratification. We also saw the behavioral patterns. We also saw families, their support. See, just think of a reality. I mean, a lot of people in healthcare and others probably are students, right? How here the payer could be different than the patients. Sometimes the therapy cost is so much. We don't even know what's the kind of support one is getting in the family. What can you do by just writing a prescription with such a person? So when we talk about personalization, even if you've onboarded someone and they are on the program with you and you have multiple interventions, be it diet, nutrition, physical therapy, I'm not going, I'm sure, emotional, all of this has to be personalized to ensure that particular patient gets better quality of life and therapeutic outcomes. And when we say therapeutic outcomes, for people who are probably students, if it's a diabetic, is an HbA1c coming down? Okay, what are the parameters? Lab test, etc. we do, right? So it's not about just feeling good, which is important, because why does a patient come? Patient does not care what is modern, what is Ayurveda. For them, when they come for treatment, it's about getting well, it's about feeling well, it's about being happy, right? All of this. So all of this is achievable only when we have personalized treatment, and that is when we can expect the best treatment outcomes.
In Ayurveda, yes, personalization is the backbone of the Ayurvedic science, I would say. Because there is a shloka in Ayurveda, it says, Swasthasya swasthya rakshanam aturasya vikar prashamanam cha. Means a person who is healthy, what are the protocols laid down to keep him healthy is one aspect. And aturasya vikar prashamanam means a person who is diseased, how to cure him. So Ayurvedic philosophy is based on personalization called as Prakriti. Prakriti is the genetic makeup which we all are born with. We all have a unique makeup of DNA. None of us look alike. None of our habits of eating food, thinking, everything is alike, right? So we are all very unique in our own self. So the protocols also as per Ayurveda, depending on the doshik Prakriti balance what we are born with, are also different. So every individual is treated as a separate entity. Again, one size doesn't fit all. Exactly implies in Ayurveda as well. So whenever we treat a particular person, we take into account their Prakriti, the current imbalance, their lifestyle, diet and lifestyle, their current emotional health, integrating everything together, the current season, the current diet and lifestyle, whatever the person is following, and then we start looking for solutions based on that particular individual. So it gives us enormous good results when we treat people individually. Some people would, work very good with a de-stressor herb like ashwagandha. The other would require Brahmi. So ashwagandha cannot go in for every Prakriti. Similarly, Brahmi also cannot go in for every Prakriti. So there is a difference when treating, and that exactly is very well personalized in the Ayurvedic science.
Great, good to know about your perspective on this. And personalization, I feel, is the need of the hour, and everyone has to be treated differently. All of us are different. All of our bodies are working differently. So I would want to ask you a follow-up question, Dr. Milind, in terms of Ayurveda and the modern medicines. So in my experience, what I've seen is both are kind of working completely differently. So there is no connection between the modern science or modern medicines and Ayurveda. So most of the doctors believing in modern science are not interested in using Ayurveda, and many people in Ayurveda who are core into Ayurveda are completely against the modern medicine. So how do you think it can work together, or how Ayurveda can complement the modern medicine, and both of them don't have to fight each other and work in harmony? So can you please tell me something about it?
Sure, definitely. See, Ayurveda is definitely a evidence-based medical science. It is a 5,000-year-old science, and if such a science which has been existing over years is still existing now, so there is definitely some potential there. The Ministry of Ayush is doing a lot of R&D in promoting Ayurveda and all. There's been a lot of misconception and a tug of war between the modern medicine and Ayurveda, saying that there are metals, there are heavy minerals used in the
Both
science.
are like against each other.
Yeah, against each other. But these two sciences coming together and complementing each other will make wonders for the humanity. Acute illnesses, definitely there are limitations on the Ayurveda side, and chronic illnesses, definitely there are limitations on the modern medicine side. So once we integrate both the sciences together, it will work wonders in favor of the humanity. Again, coming to the, the mineral composition and all, yes, Ayurveda does use. Now, the biggest issue why this whole controversy started is regulation in terms of isolating the quacks. People who have been practicing Ayurveda, there have been a lot of quacks around. The science has given protocols to administer, like even modern medicine. Steroids are given to a particular limit, a particular duration, and with a particular dosage. Similarly, in Ayurveda, all these herbo-mineral combinations, which are utmost purified, have to be prescribed with that kind of utmost precaution of dosage and duration. When people are unaware of it and it has been, unduly prescribed and taken, definitely on either side, whether it is the modern medicine or Ayurveda, is going to impact. As simple as, even our food. Chilies, the amount of chili goes into the stomach, it is going to adversely react to the gut. So similarly, all these medications, let it be herbs, let it be the modern medicine, is definitely going to impact the body. So when these sciences combine together, the modern diagnostic approaches taken by the Ayurveda science, Ayurveda protocols of treating applied, we have seen the changes in the blood composition, the blood work of the patients. Similarly, from the modern perspective, chronic ailments like backache and all, where, definitely a combination of physio and all plus Ayurveda treatments, they also work. So a combination of these two definitely works wonders. Coming to the fertility aspect, I would say in the modern science, the fertility aspect has hormones as a solution to work upon. Either it is a male system or a female system. But in Ayurveda, there are herbs which actually work on the female system and the male system both. And the results are on the paper. Even issues like bilateral tubal block, certain conditions, Ayurveda opens it naturally with Panchakarma. So there are impactful results in the Ayurvedic sciences also. So I think both the sciences coming together, bridge together, will definitely complement each other rather than having a controversial aspect which is being developed in the market.
Sure, thank you. So Panchakarma is also a very important
Absolutely.
Modality, a protocol to be used in terms of the treatment of the patient,
Yes.
like prevention, right?
Yes. See, detoxification, like I said, Ayurveda is designed for prevention and cure both. So timely going for Ayurveda Panchakarma with a consultation with the Ayurveda doctor. So he analyzes what is the underlying Panchakarma needed, of which dosha is out of balance. Accordingly, it can be done. So basically, Panchakarma is done for both aspects, preventative and curative. So depending on which dosha is out of balance, the Panchakarma is advised. Now, the disease progression phase, how it occurs. Ayurveda says when a dosha goes out of balance, it starts accumulating in an area. So they called it Sanchay Avastha. Sanchay. Okay, then it becomes Prakop. Prakop means it starts aggravating the dosha. Then Prasar, it starts moving. Then Stan Sanchay, it goes and localizes in that particular weak area of the body. And then the disease manifestation happens. So once we know what the path of the disease manifestation, at what stage the dosha imbalance is there, if it is a aggravated dosha is in the mobilizing stage or it is in the accumulation stage, we can immediately nib it there only and reverse the condition from that stage itself rather than waiting for the disease to manifest. So that is where Panchakarma works.
Great. So Panchakarma is a vast subject.
Yes,
Earlier I was thinking it's only about massages and massage related treatments, but later on, like, I kept learning and there's so much into it, different kind of treatments and how the oil and herbs are all used in your bodies for the treatment. It's amazing, right? In terms of the Indian knowledge or the traditional knowledge. So I would want to ask you guys the last question, which is more about the preventive health. So in this whole integrative health approach, where do you think the preventive healthcare fit in, and also how is wellness approach more suitable for the prevention of diseases? Thank you.
So I think we all know we are diabetic capital, etc., etc. But just to let you know, 70% of global people that are suffering, no, are of chronic diseases only, globally. So when that happens, do you think a drug alone can help, a prescription drug? Because chronic diseases is something we've heard about, compliances we've heard. So if we want the disease burden, whether it's India or otherwise, there has to be focus on the pillars of treatment of chronic diseases, which will remain diet and nutrition, physical activity, emotional well-being, community support, and only then can we see the reduction in hospitalization, better quality of life, the complication that happens with these diseases. If you hear people are diabetic, but what is it that people are dying of or suffering of? It's the complication and many such diseases. So it is very, very important and pertinent that we work on all of this to ensure a better quality of life. And this is something simple, but if it was so easy to understand and practice, we still will not have 70% of the people suffering, right, of chronic diseases and not being able to take control. And I really think, as a last statement, healthcare in general, I think the whole approach has to be more compassionate, human, and more focus on the health, because there's so much of commercialization everywhere that sometimes we really forget, especially in our country like India, where the patient is the center, patient is the one who's paying for it. At least what they deserve is a fair treatment and an honest treatment, so that they can at least get the benefit. And if you see the whole chain, all of us, hospitals, labs, people like us, we all make money from that patient. I think it's the least we can do is to be honest with that patient when they're suffering. Thank you.
Yeah, rightly said. Being honest with the patient. I have experienced this. Most of the times, the patients are not educated what they are actually going through. When I have seen the fertility cases, people don't know what is the underlying cause for their fertility, and which is kept hidden all the time unless and until they are, stress is one of the major factors these days.
Yeah.
So, prevention is better than cure. So that is what Ayurveda also it focuses on. Swasthya se swasthya rakshanam is the first statement of the science. And then atura se vikar prashaman. So if you fall sick at all, then what is the cure for it? So when it is swasthya se swasthya rakshanam, Ayurveda has given a wonderful shloka in the form of who is called as a healthy person. And World Health Organization also supports the same definition these days. It says, Sama dosha, sama agnisha, sama dhatu malkriyaha, prasanna atma indriya mana swasthaitya vidhyate. It means there are 3 doshas in our body, vata, pitta, kapha. They are responsible for making the genetic makeup of us. Plus, on a daily basis, they are also involved in daily functionality, the physiology of our body also. They should be balanced. So, sama dosha, sama agni. Sama agni is basically the metabolic fire, which is responsible to carry out overall metabolism into the body, right from cellular level to the whole body level. Sama dosha, samagnisha, sama dhatu. We have 7 tissues in our body: muscle, bone, blood, so fat tissue. So there are different 7 tissues. They should be balanced. They are agnis. They also have their own metabolic fires. They should be balanced. The elimination of the waste should be normal, and mind, soul, and senses should be in harmony. If we meet all these criterias, then only a person is called as a healthy person in Ayurveda. So prevention and wellness goes on well with the Ayurvedic principles revolving around the deck of the healthy person definition, which Ayurveda has stated and given. So when it comes to the healing, what comes at the body level is the last. The damage starts from the cellular level. So the cells get damaged, then it creates damage in the tissues, then the organ, then the system, and the body starts suffering. Now we cannot expect a miracle by just popping a pill and allowing the reversal happen from the cellular level. The symptomatic relief might happen, But what that chronicity, which has to be eradicated from the cellular level, it takes time. So that is why when it comes to wellness and integration of different practices of Ayurveda, naturopathy, yoga, at Swastik Wellbeing we integrate all of them and we make sure we work right away from the cellular level so that the inflammation starts reducing and the healing starts from the cellular level upward to the body level rather than going from the body level backwards to the cellular level. Thank you.
Great. So the key over here is balance. So everything has to be in balance in our bodies, mind and body. All the cells as well have to be in the most homeostatic stage. So being in ease is basically the most important factor, I feel, when we have a disease. So your body is not at ease. So if your body is at ease all the time, I think you don't have a disease and you're like a healthy person. So I would like to open the stage for you guys, and if you have anything else to say which you missed, you can maybe say, and if anyone of you has any questions, you can feel free to ask any of us any questions you might have. Thank you.
So a wonderful question. See, like I said, mana, mind, health. When I describe the definition of healthy person as per I, the mind plays an important role. When it speaks of mind, buddhi also comes in. So basically, when you're working with neurosciences, it is the buddhi which comes into action. So neuroscience works with the buddhi thing in Ayurveda. When I need to compare on both the sides, the modern aspect and the Ayurveda aspect. Now, coming to the sleep, insomnia, why we go to the root cause basically when we treat, where the tubulating factor is coming in. So basically vata imbalance, which is responsible for a lot of stimulation into the system, is being addressed first. Vata is a moving force. It is a nervous force. So whenever there is instability in vata and it is continuously moving, an integrated approach is needed here to understand where the problem is lying first. And that involves everything, whether the person's life is having a lot of stimulants in his life in terms of, caffeine intake, the kind of food, is it a lot of processed food which is inducing a lot of bloating and gas into the system. The elimination, of course, if the elimination is not too good, again it impacts the gut-brain axis, leading to imbalance in the nervous system as well. So when we integrate everything, so the first step towards it is correcting the lifestyle and the diet, and then supporting it with some detox processes to eliminate this toxin in the form of aggravated vata which is there, which is causing this continuous disturbance of sleep and stimulation. And then supporting with the herbs which help in, reducing the stimulation into the mind. And of course, meditation and yogic practices, like the food what we eat nourishes the body. The pranayama which is done in the morning times nourishes the mind. So it helps to reduce the cortisol levels and helps improve the sleep pattern. And we have evidently seen this at Swastik Wellbeing also, where people who were on melatonin intake and all, while on the program, they have stopped it completely. And the sleep quality had improved because the inflammation in the system and the vata levels in the system dropped down. Yeah. So the medicines, again, the philosophical difference is quite opposite to each other. The modern medicine works on blocking and suppressing. Ayurveda works on working on the root cause. So these herbs which are there, they work on the root cause. Basically, mind is very hyperactive. So it is basically vata stimulation which is going on. So it helps in reducing the vata. And it doesn't cause the sedative effect where the brain gets blocked. The brain is activated and the mind is calmed down. That is how the Ayurveda medicines work in the treatment of the sleep and other psychological issues.
So it's more like bringing balance.
Balance, yeah.
And also for sleep, I feel the thoughts also needs to be balanced. Otherwise, somebody just keeps on thinking something or are not able to forget something. Then they are not being able to sleep, I guess. So Ayurvedic drugs, they kind of balance everything, your thoughts, mind, sleep. So it brings the right balance in your life, I feel. So that, if somebody is sleeping too much, then it will help them to be awake. If someone is not being able to sleep, it will get them some sleep. Yeah.
And to add this, in the modern day living, we all have forgotten to live. We speak of circadian rhythm, but we don't have a eating time, we don't have a sleeping time. And all this has been a reason for imbalance into the system. Last 2 decades in India, see the amount of lifestyle issues which have gone up drastically. The reason is only the revolves around the kind of living which we are going through. What is circadian rhythm? It's basically a biological clock which is there in Ayurveda. We have these 3 doshas, Vata, Pitta, Kapha. Like you have a sunrise and sunset time, similarly these doshas have a pattern time of working. We have to follow their time, they'll not follow our time. The moment we go against their time, body will start reacting. Midnight, 12 o'clock, we are having brunches these days, which is the time for the body to sleep. Actually, it is a metabolic rest time. And if we are having a brunch during that time, the amount of inflammation which is induced in the system is quite high. If you see hypertension, any heart issue, diabetes, even dyslipidemia doesn't come overnight. It's the kind of wrong practices which we follow is one aspect of it, and second aspect is the source from where the food is coming to a plate. All the tetra packed milk these days which is coming, the industrialization which has happened, we all have to work about all these aspects of getting healthier, nutritious, clean food to our plates. Then the things will improve overall for all of us. Absolutely, ma'am. See, in cancer, the modern aspect is there, and which induces inflammation into the system quite a bit. When we work, what is cancer basically? It is multiplication of the cells which grows on. The multiplication in Ayurveda, from the Ayurvedic perspective, is increase of Vata. So basically, when we are working with cancer, we are actually arresting the Vata. When the Vata is arrested, the multiplication slows down. And also when people have undergone other treatments in the modern aspect of chemotherapy and all, and they come with the Ayurvedic perspective, whatever impact would these medicines would have made, we will help in recover those and re-establish the balance into the system. So definitely it is advised to go in with Ayurveda also along with it. Again, yeah, rightly, you said, ma'am, if Ayurveda, see, it all depends on the right consultation what you get and the right medicine which is prescribed. Diagnosis to be done right. If all these aspects are made, Ayurveda works faster. In my career, I have seen a person suffering with hyperacidity for a decade have recovered in a week's time. And he was off his antacids. Fertility cases suffering for years together, a decade with IVF cycles, have conceived even in 3 months. So I don't see that, Ayurveda takes time. It depends on the right approach and right medication.
There are many fast-acting herbs and medicines, like cannabis also is like a very fast-acting drug. So you need to know about the products. Thank you. Thank you so much. Yeah, thank you.